Every year, millions of seniors undergo routine health tests, believing they're helping them stay healthy. But what if some of these tests, the ones you trust to monitor your well-being, could actually be causing more harm than good? Studies show that up to 30% of routine medical tests in older adults lead to unnecessary procedures, complications, and even long-term health risks. In fact, some tests could actually increase your chances of developing serious conditions like cancer or heart disease. How is that possible? Stick around because in this video, we'll dive into 5 common health checkups that may be doing more harm than good and reveal smarter alternatives that could actually improve your health. Let's explore why some of the tests you've been told are essential might actually be putting you at risk. When we think about bone health, we often imagine bone density tests, or DEXA scans, as a must-have for anyone over 50. The truth, however, is more complicated. Many seniors are routinely prescribed bone density tests under the assumption that they'll reveal whether they're at risk for osteoporosis or fractures. But the reality is that for many people, especially those without significant symptoms or risk factors, these tests are not only unnecessary, they can lead to overdiagnosis and overtreatment. A major concern is that bone density naturally decreases with age, but this doesn't necessarily equate to fragile bones or an increased risk of fractures. In fact, studies have shown that mild bone loss in older adults, especially those over 70, is a normal part of the aging process and doesn't always require medication. Research published in the Journal of the American Geriatric Society found that bisphosphonates, the drugs commonly prescribed after a bone density test shows low bone mass, have little to no impact on reducing fractures in older adults. One large study showed that bisphosphonates reduced fracture risk by only 0.3% after 5 years. The real danger lies in the side effects of these medications. Bisphosphonates can cause severe issues such as jawbone death, osteonecrosis, gastrointestinal problems, and bone fractures from atypical stress. For example, one of my patients, a 74-year-old woman named Mary, was prescribed bisphosphonates after a bone density scan showed mild osteopenia. Within 3 months, she developed severe digestive issues and had to stop her medication. Instead, we recommended a combination of weight-bearing exercises, vitamin D supplements, and a diet rich in calcium. A year later, Mary was not only feeling better, but also had no fractures. The key takeaway: if you're over 50 and haven't had a significant fall or shown any symptoms of osteoporosis, the better approach might be focusing on lifestyle changes, like strength training, a balanced diet, and proper nutrition, rather than relying on routine tests and medications. For many seniors, the annual physical is a staple of their healthcare routine. But are these checkups truly necessary? Or are they just a time-consuming habit that leads to unnecessary tests and treatments? The reality is that routine annual physicals often don't provide much value, especially for those who are otherwise healthy. According to the American College of Physicians, evidence suggests that for many older adults, especially those without any specific symptoms or risk factors, these yearly exams do not significantly improve health outcomes. In fact, they may lead to unnecessary tests, referrals, and even treatments that do more harm than good. A key issue is that annual checkups often trigger a cycle of additional tests, many of which may be completely unnecessary. For example, a routine blood test might uncover a slightly elevated cholesterol level, prompting further testing and medication, even if the patient isn't showing any symptoms of heart disease. Similarly, an unremarkable physical exam can lead to a referral for imaging tests like X-rays or MRIs, which carry risks such as unnecessary radiation exposure and false positives. Colonoscopy is often touted as a must-have screening after age 50, but the benefits for seniors, especially those over 75, are much more limited than you might think. While colonoscopies can detect early signs of colon cancer, studies show that for seniors without symptoms or a family history, the risks often outweigh the benefits. Research published in the Journal of the American Medical Association, JAMA, found that the benefit of routine colonoscopies after 75 is minimal. For every 1,000 people over 75 who undergo a colonoscopy, only about 2 lives are saved, but over 20 people experience serious complications such as bleeding, perforation, or even heart rhythm disturbances during sedation. Instead of routine colonoscopies, the U.S. Preventive Services Task Force, USPSTF, suggests a more individualized approach for those over 75, recommending screenings only if there's a clear risk or history of colon cancer. For most seniors, non-invasive alternatives like the FIT test, fecal immunochemical test, offer a safer and equally effective method of detecting early signs of colon cancer without the risks and complications associated with the procedure. Cardiac stress tests are commonly given to seniors to assess heart function. But did you know that these tests often lead to false alarms and unnecessary procedures? Stress tests, where patients walk on a treadmill or take medication to simulate exercise, are meant to detect blocked arteries. However, research shows that the accuracy of these tests drops significantly after age 70, with a false positive rate as high as 40% in older adults. This means that for nearly half of seniors who undergo a stress test, the results will show abnormalities that aren't actually there. These false positives often lead to invasive follow-up procedures, like angiograms or even stent placements, which carry significant risks, ranging from bleeding complications to kidney damage from contrast dyes. A 2017 study in JAMA Cardiology revealed that over half of the stents placed following a stress test were unnecessary, with no improvement in survival or quality of life. For many seniors, the cause of fatigue or chest tightness may not be heart disease, but simply aging or other non-cardiac factors. Instead of routine stress tests, seniors with mild symptoms should consider safer alternatives, such as a resting EKG or a coronary calcium scan, both of which offer a clearer picture of heart health without the risks of unnecessary procedures. Full-body CT scans are often marketed as a way to catch hidden health issues early, but the reality is far more concerning, especially for seniors. These scans expose the body to high doses of ionizing radiation, far more than standard X-rays. A single full-body CT scan can deliver anywhere from 10 to 20 millisieverts of radiation, equivalent to 500 chest X-rays. Research published in JAMA Internal Medicine shows that this exposure can significantly increase the risk of cancer, with the potential to cause up to 5% of all cancers in the U.S., a figure comparable to the cancer risk associated with daily alcohol consumption. What's even more troubling is that there's no substantial evidence that full-body CT scans improve health outcomes in asymptomatic individuals. Studies have shown that these scans often detect harmless abnormalities, such as small cysts or calcifications, that pose no real threat. But once they're found, the result is often a cascade of unnecessary follow-up tests, biopsies, and even surgeries, which can cause more harm than good. Given the high radiation risk and lack of proven benefit, experts recommend against using full-body CT scans as a screening tool for healthy seniors. Instead, targeted imaging based on specific symptoms or concerns is far safer and more effective. Brain MR is commonly recommended when seniors experience memory issues. But what if this seemingly harmless test could actually cause more harm than good? While MRs provide detailed images of the brain, they rarely offer clear answers for people with mild cognitive complaints. In fact, studies show that in seniors, MRIs often reveal age-related changes, such as small areas of shrinkage or white matter lesions, that are completely normal as we age. These findings can lead to unnecessary anxiety, further tests, and even invasive procedures, all without improving the patient's quality of life. A 2021 study published in Neurology Today found that of the 3,000 MRI scans of people aged 70 to 85 with mild memory complaints, 86% showed some form of brain abnormality, but only 3% were linked to treatable conditions. In many cases, these abnormalities were simply a natural part of aging, Yet when these changes were discovered, they often triggered unnecessary procedures such as spinal taps or even exploratory biopsies, procedures that could carry significant risks without offering any real benefits. Rather than turning to MRIs for minor memory issues, a cognitive screening test is a far better first step. This paper-based test is not only more affordable but also more effective at identifying cognitive decline in its early stages, without the panic or invasive follow-ups that come with MRI scans. As we age, staying healthy isn't just about routine screenings or invasive tests, it's about prevention. Rather than relying on annual exams or unnecessary procedures, focusing on proactive lifestyle changes can have a far greater impact on your long-term health. Physical activity plays a pivotal role in maintaining heart health, bone strength, and cognitive function. A regular routine of strength training and aerobic exercise can reduce your risk of stroke, diabetes, and even cancer. In fact, a study published in the Journal of Clinical Oncology found that regular exercise can lower the risk of cancer recurrence in seniors by up to 40%. Nutrition is equally vital. A diet rich in fiber, fruits, and vegetables, and low in processed foods, helps control weight, prevent heart disease, and improve gut health. Targeted screenings like checking for blood pressure, blood sugar, and cholesterol levels are far more effective than general exams or full-body scans. Lastly, mental health matters. Cognitive exercises, staying socially active, and proper sleep hygiene contribute significantly to brain health. By choosing the right preventative measures and focusing on lifestyle over invasive tests, seniors can maintain a better quality of life without the risks associated with unnecessary screenings. It's about being selective and informed, empowering yourself to live well. We've covered a lot today, from the risks of overused tests to the power of preventative measures. Now, I want to hear from you. Have you ever undergone a test or procedure that you later regretted? Maybe it was a routine screening that caused unnecessary anxiety, or a treatment you felt wasn't needed. We all have unique health journeys, and by sharing your experiences, we can learn from each other. So take a moment to comment below. What tests have you had, and how did they impact your health? Do you think certain procedures are overused in the healthcare system? Your stories not only help others, but also foster a community of individuals who are actively taking charge of their health and making informed decisions. Let's keep the conversation going. If you found this video helpful, don't forget to like and subscribe. We're here to give you the latest tips and insights on staying healthy after 50. Stay tuned for more videos, where we'll dive deeper into how to make the best choices for your health without getting caught up in unnecessary tests.